I recall during my first physiotherapy session, his room was nicely decorated and very clean. With his warm greeting by my name and smiling through his eyes in a massed-up premises, he almost instantly created an emotional, safe environment for me to receive subsequent treatment alone. As time went by, I observed that he is really genuine in helping me, highly knowledgeable and communicates clearly about my treatments. He also provides a good listening ear and demonstrates active listening whenever I unload my frustration about my injury. He is truly a great healthcare professional who provided constant high-quality care for both my physical and mental well-being.
Yeah, so what a journey, right? Okay, I'm really happy that you are all good and returning to all the activities that you always wanted to do after your injury. Yeah, so remember those are very frustrating conversations that we had about your circumstance. Okay, I'm really glad that we managed to sort all those out. That's why I feel that it's very important to be emotionally present, for patients whenever they are unloading their frustration, because it's true, all these difficult conversations, that we really can foster respect, and trust, and all this will actually facilitate a very successful rehab down the road.
Once there's a complex care patient who was discharged from the hospital, and his care was very complex. He required oxygen, suctioning, and he was bed-bound. So before discharge, the caregiver was very worried that she approached me, Jane, who is the caregiver, that she wants the outpatient visit to be coordinated. So actually, I went to speak to the various doctors and care providers so that we can see him in one room on the same day. So on the day itself, the visit was very smooth, and actually Jane appreciated the care that we rendered to her.
Okay, so my son Dominic, he is minimally conscious and bedbound, and when we come to the hospital for checkups and appointments with the doctors, we often have to see a few doctors at one time. So Sister Mo graciously accommodates the request from us to coordinate the visits from the doctors. Despite herself being so busy, she makes sure that the appointments run smoothly, the doctors come in on time, and my son is seen too. And that gives me a lot of assurance and confidence in future visits.
Taking a step back and for us to understand that actually to the patient, what they are dealing with is actually everything, and it's the most significant event in their life at that particular moment in time. I think the ability to really try to take the perspective from the patient really makes a difference in allowing us to be more patient and cut them some slack, even though they may be being unreasonable at times. But to do that, it's also important that our mental health is strong, we look after ourselves well, and we're well rested. So I really encourage my fellow healthcare workers to make sure that they take care of themselves so that they are better equipped to take care of the patients that we serve.
Good patient care means that the patient's overall health is optimized after we provide care to the patient. If a patient is admitted to the ward for pneumonia, apart from treating with the appropriate antibiotics and instituting frequent monitoring to ensure clinical improvement, I'd also take note of the patient's background medical problems.
So patients should be at ease when we provide a service and should have confidence in our skills, especially during blood taking, where many patients feel very nervous and anxious thinking about the needles and the pain. I reassure patients that it's going to be a very fast process and that I will try my best to make it as painless as possible. The way we communicate with our patients and display our skills plays an important role.
As a clinician in an outpatient setting, sessions are per appointment basis, and that can be incredibly stressful. From a service provider point of view, rigidity of the sessions, the unpredictability of the patient's condition, and punctuality make each patient interaction challenging. I don't think about it very much, to be honest. I try to stay focused on the individual in front of me, prioritize the tasks accordingly, and rely on the support of my colleagues to work collaboratively. Keeping in mind that for patients, it is an ordeal coming to the hospital. The logistical and scheduling nightmare of arriving at the hospital for an appointment to receive treatment, especially when they may not be as mobile as they normally would be.
Active listening. Zach is a very good listener, and he seemed to have this superpower of listening to me while typing on the keyboard simultaneously, even without looking at it, and still be able to accurately understand what mattered to me. Being present as well. Zach is always somewhere near me when I'm doing the prescribed exercises. He's also very personable, very friendly, and sometimes he'll also joke with me. Definitely, he's also caring. He could tell that I'm exhausted, and he will let me off the hook by cutting down some of the reps. And when I'm in pain, he will tell me not to push too much or to go slow.
What I find useful is practicing mini moments of mindfulness, such as by taking a few deep breaths in between clinic consultations. As we work in teams, I also make it a point to check in on my juniors when in the inpatient setting and my clinic assistants in the outpatient setting, as they are the first points of contact with the patients and the next of kin. I think that maintaining the morale of my team members is important to maintain delivery of a high level of overall optimal care, especially during high-pressure situations.
I recalled a patient looking worried as she wanted to submit a massive consent authorizing form to us, but all the counters at business office were busy. I politely requested for the patient that I was serving at the moment to pause for a while and seek for permission to actually direct the patient to drop the MediSave form into the box outside the business office. She shared that she was anxious after submitting the MediSave form. So I actually have assisted her and made her experience at the business office a pleasant one.
Continue to deliver excellent patient service. One day, all our efforts and dedications will be recognized. Keep going, and one day at a time.
Happy 5th year anniversary, SKH. I'm so glad you're in my neighborhood.
Happy 5th anniversary to Sengkang General Hospital. You're healing the heart, mind, soul, and body of patients and caregiver. This also celebrates continuous years of nurturing healthcare talents in Singapore's healthcare industry.